Everyone has heard about COVID-19. According to information on the webpage of the Johns Hopkins University of Medicine, the observed case fatality ratio in Germany, for example, is 0.4%. In Denmark 0.2%. In Australia 0.2%. And in the US 1.1%. I am sure a lot of you have caught a seasonal flu caused by flu viruses at least couple of times. The World Health Organization (WHO) estimates that the case fatality rate (CFR) for the seasonal flu is usually well below 0.1%. What about viruses like Ebola? Are they the deadliest? There are 5 strains of the Ebola virus, each named after countries and regions in Africa: Zaire, Sudan, Thai Forest, Bundibugyo and Reston. In outbreaks caused by the Zaire Ebola virus, the CFR has historically been very high, often ranging from 25% to 90%. Have you heard also about the Marburg virus? The Marburg virus is a hemorrhagic fever virus. As with Ebola, the Marburg virus causes convulsions and bleeding of mucous membranes, skin and organs. In general, Marburg virus disease has had high fatality rates in past outbreaks, often exceeding 20% and sometimes approaching or exceeding 50%. But which is the virus that has a nearly 100% fatality rate after symptoms occur? This is a virus that turns animals and humans into zombies. Hydrophobia, hallucinations, paralysis, these are the harbingers of the virus's deadly crescendo. Have you seen wild animals like foxes who behave abnormally aggressive and have foaming at the mouth? It is a scary scene, isn't it? All of this is caused by rabies. Before continuing, please subscribe to my channel for more videos like this and hear this disclaimer. This video content is made for informational and educational purposes only. The video content is not intended to substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare professionals if you have any questions regarding a medical condition. Now let's continue. Rabies, caused by the Lissa virus, primarily affects mammals. Within this viral family, it has earned a reputation as the most deadly, boasting an almost 100% fatality rate once clinical symptoms appear. In many parts of the world, rabies is maintained in wildlife populations. Common reservoir hosts include bats, raccoons, skunks, and foxes. Rabies transmission is a delicate dance between host and virus. Typically carried by carnivores and bats, the virus is transmitted through saliva, often via bites. Scratches and open wounds can also pose a risk if they come into contact with infected saliva. The virus is present in the saliva of infected animals, and transmission occurs when the virus enters the body, typically through a break in the skin or mucous membranes. The calculated efficiency of transmission is what makes rabies such a formidable foe. Once inside the host, the rabies virus utilizes its glycoprotein spikes to attach to nerve cells, allowing it to infiltrate the central nervous system. This efficient invasion sets the stage for the virus to hijack the host's cellular machinery and spread rapidly. Rabies is a master of subtlety during its incubation period. The incubation period of rabies, which is the time between exposure to the virus and the onset of symptoms, can vary. On average, it is generally in the range of 1 to 3 months, but it can be shorter or longer in some cases. This serves as a deceptive calm before the storm, with no apparent symptoms until the virus reaches the brain. The symptoms of rabies can be divided into the following stages. 1. Prodromal stage. Fever and malaise. The initial symptoms may resemble those of the flu, including fever, headache, and a general feeling of discomfort or malaise. Pain and tingling. There may be pain or a tingling sensation at the site of the bite or exposure. 2. Acute neurologic period. At this stage, people can experience 2 types of rabies. Furious rabies. Most people experience this type as its name suggests. This form of rabies is characterized by violent physical and neurologic symptoms. Death will most often be caused by cardio-respiratory arrest. Paralytic rabies accounts for about 20% of cases and will cause muscles to gradually weaken, starting from the site of the exposure and expanding outward. Paralysis and death will eventually ensue, usually by respiratory failure. Symptoms of rabies occurring during the acute neurologic period may include hyperactivity, confusion, hallucinations, and agitation. The affected person may experience anxiety, restlessness, and difficulty swallowing, hydrophobia. They may become aggressive and attempt to bite others. The muscles may go into spasms, and there can be uncontrolled movements. Paralysis can spread, leading to difficulty breathing and, eventually, respiratory failure. Despite its notorious fatality rate, rabies is preventable. Post-exposure prophylaxis, which includes a series of rabies vaccinations, can interrupt the virus's progression if administered promptly after exposure. However, once symptoms manifest, the chances of survival dwindle rapidly. Rabies is not confined by borders. It causes tens of thousands of deaths every year, mainly in Asia and Africa, 40% of whom are children under 15 years of age. The impact on public health, agriculture, and economies is profound, emphasizing the importance of global efforts to control and prevent its spread. According to World Health Organization, globally rabies causes an estimated cost of $8.6 billion United States dollars per year. While rabies is a serious and potentially deadly disease, human cases are relatively rare in countries with effective rabies vaccination programs for domestic animals. As we conclude our scientific journey into the realm of rabies, the call to action is clear. Through continued research, public awareness, and widespread vaccination efforts, we can collectively work towards minimizing the threat posed by this deadliest of viruses. Thank you for joining us on this scientific exploration of rabies, a virus that, while deadly, is not invincible. If you found this video informative, please give it a thumbs up and don't forget to subscribe to the channel for more videos like this. See you next time.